episode, we're talking more about schizophrenia. I'm your host, USP, and our guest is.
Dr. Lekan,
Welcome.
thank you.
Define the term schizophrenia.
Okay, when you talk of schizophrenia,
Mm.
it's an example of psychotic disorder. When you say psychotic disorder, we are talking of those disorders that affect our brain functionality. So maybe you have heard another word, psychotic. Psychotic, what is psychosis? I should start by defining what psychosis is. When you say psychosis, it's a mental condition whereby an individual has lost touch to the reality. Or I should say, an individual has lost touch with the reality. What do I mean? You and me, when we are here, we are talking of the same, we are on the same page. Okay? When I say something, you're able to understand what I'm saying. Unless it's a technical thing, which maybe is beyond you. But when I say, can you get that thing? You're able to hear me. When you say hi, I'm able to greet you back. But someone who has lost touch with the reality, they don't function. Their brain doesn't function the way we used to know as a human being. For example, they may present with features of uh, they may be able to see things which other people cannot be able to see. For example, maybe you have heard or you have seen someone pointing at a wall. I'm able to see a person there. They are pointing at me. Or they are doing such things, but when you look at that place, there's nobody. Okay, or some people may say I'm able to see a dog who is coming to me. The dog is coming to me. I think it wants to bite me. But when you look at where the person is pointing, you see nothing. Thus, all these things, like sometimes they are also able to feel some smells which are not there. You see someone, I think I can smell beef being cooked somewhere, but there's no smell of such kind around you. Sometimes they may say things are moving around my body. Okay, I feel like ants are moving around my body, and they are constantly removing them. You see them like removing things which are moving around their body. But when you look at their skin, you see nothing on their body. And sometimes these people also tend to hear things which other people are not hearing. For example, they may say, I think someone is calling me outside. Someone is mentioning my name outside. But when you listen attentively, you are close to them, and when you listen, you hear no any sound, not even someone calling them. Some people may say, I think those people they are saying they want to kill me. Let me run. But when you listen, no one is talking about them. All these things which I have explained so far are what we call hallucinations. Also, the other feature apart from hallucinations, people also tend to have beliefs which they hold with great conviction. They have certain beliefs which themselves they believe that thing which they are thinking is true, but it's not consistent with the community. Like people who are around are not agreeing with them, but to them they believe that. For example, someone may say, I think I'm in love, this girl is in love with me. But when you try to ask around, there is completely nothing about these people. This we call delusions of love. Some people may say, I think someone is planning to kill me. They just think that people want to kill me. But when you find out there is completely no one who is trying to kill them. Some people may say, I feel like part of my body is rotting. I think my part of my body is dying. But when you look at them, they are not even sick. They are completely fine. But they believe, if you can't even change their belief. That's what they believe. They believe the part of their body is dying or the part of their body is rotting. But you take them to the hospital, they are completely fine. So then they don't even have any symptom or any medical disorder. Sometimes they also experience maybe some people they think like maybe they are in close relationship with God. I mean God. Some people say God is my son. Okay, not no, I'm not talking about the prophets who claim to be in close relationship with God, but someone who is sick. If a prophet is saying I'm a son of God and I communicate with God every day, and you know that person is a prophet, you cannot be surprised. But let's say it's me. I'm not known with preaching. I'm not known with prophesying. But if I wake up today and I say, I think I was talking to God during the night. He told me that I'm going to be rich. You'll be putting question marks. What is happening to this guy? So all these are what we call delusions. To them, they believe it is true, but there's no any connection. There are so many. There are so many examples of delusions. For example, uh, someone may try to connect things which are not related. Let's say you are walking with me along the road, and I see as someone wearing blue. Okay, then I say, I have seen someone wearing blue. I think tomorrow someone is going to die from our campus. Then you'll be like, what? What is the connection? But that's what this person is believing. When he sees someone wearing blue, it means someone is going to die at their campus. But to you, you see, no, it doesn't make sense. But to them, it makes sense. So it means they have lost touch with the reality. That's basically the definition. And also sometimes they may have disorganized speech. You hear them talking around. They're just talking around throughout the night. You can't even make whatever they're saying. I think someone is trying to bewitch me, but tomorrow I'm going to school. Don't worry, he's going to be fine. I even have money more than president. Yesterday I ate in Sima. My laptop is not working properly. You can't even make what is this person saying? That's disorganized speech. Sometimes disorganized speech is also seen in whereby I'm talking to you and then I'm asking you, Wiz, what did you eat yesterday? And then you are telling me, but I wasn't wrong. Whatever they said, I heard them. But don't worry, my laptop is fine. You see, I've asked you what you have eaten yesterday, but you are telling me things which are not even here. That's also a disorganized speech. And also sometimes they have disorganized behavior. So where is when I say disorganized behavior, what do I mean? Sometimes you see someone just they carry things, a lot of things on their head, papers, clothes, broken plastics, metals, all over their body. When you ask them why are you carrying these things, they will tell, I think people are trying to steal this. When I keep in my house, people want to steal them. So I'm moving with them everywhere. See? So these people, that's what they believe. Yeah, basically that's it. That's the basic definition. There's a lot I can explain to define the schizophrenia, but so an example of this psychosis is schizophrenia. Thank you.
Alright, what are the causes of schizophrenia?
Okay, so I can say generally there is no specific thing which you and me can point to say this one causes schizophrenia,
Yeah.
but there are some speculations which are there. Like people mention about the derangements of neurotransmitters like chemicals which coordinate functionality of our cells in the brain, which we call neurotransmitters. So the arrangements in the production and functionality of these chemicals in our brain, they are said to be related to schizophrenia. Yeah, basically.
And what are the risk factors for schizophrenia?
So talking about the risk factors, there are so many, but the common one is positive positive family history. When I say positive family history, is the more close you are, I mean, the more closely related you are with someone in your family who ever suffered from schizophrenia, the higher the risk. What I mean is, let's say you have your father who has had or he has schizophrenia, chronic schizophrenia. There is a risk for you to develop schizophrenia sometime in your life, or sometimes maybe your children, because it depends on the genes. So sometimes genes for schizophrenia, for psychosis can run in the family. One, it means family history. The other risk factor is brain abnormalities. Let's say maybe you have been involved in injuries, brain injuries. Okay, maybe you have been involved in some road traffic accidents, and then you have been hitting your head to the ground. Sometimes you may develop abnormalities in the neurotransmitters of your brain, and you can suffer from schizophrenia. The other risk factor is drug and substance abuse. You and me, when you go to Zomba Mental Hospital today, you're going to find that maybe close to 80%, maybe 80 to 90% of male patients who are there at the Zomba Mental Hospital, almost 80 to 90% are due to drug and substance abuse, especially alcohol and cannabis. So the use of these substances is also a risk factor. The other risk factor is adverse life events. For example, children who have been passing through a lot in their life from their childhood, they tend to use their brain so much to the extent that they burn up their cells. Let's say you have been, since childhood, you have been abused by your parents. Let's say you were grown, like you have been raised uh, by your stepmom or stepfather. I hope you have ever heard that girl, especially not girls only, but people struggle with step parents. They may not like them, but since maybe your mother or your father is living with this stepchild, I mean step parent, you have no choice. You live in that family, but you'll be worried every day because of the treatment which you have been receiving. So it means your brain is functioning more than it's supposed to do. So it is also predisposing to the condition. Yeah, basically those are the some of the risk factors.
How do people with schizophrenia present?
Yes. Okay. How do they present? Like I said,
Mm.
they present with things which I have already explained in the definition. If you are listening to what I've said,
Mm.
they present with hallucinations. An example of a hallucination is whereby they are able to hear voices which other people cannot hear, see things which other people are not able to see,
Mm.
feeling smells which other people cannot smell, feeling things moving around their body, but people cannot see anything, so feeling that the part of their body is dying while they are completely okay, feeling that someone is loving them while they are not in love at all, feeling that other people are running to kill them, or some people are jealous of them while it's not the case. They have disorganized speech. I have already explained about disorganized speech. They have disorganized behavior. You hear them, they don't take care of themselves. They are normally not clean. To them, it's not a problem. They don't see any problem with them dressing that way. Okay? Yeah, so those are some of the principles. Sometimes they have negative symptoms. I think I forgot to mention about negative symptoms. When I say negative symptoms, I mean things which a person is supposed, ideal person is supposed to do, but they don't do them. For example, the people who are mad, people, I avoid the word madness, of course, but people who have schizophrenia, they tend not to they tend not to associate with other people like they used to do in the past. They tend to be alone. People who have schizophrenia, they are not able to talk with other people properly. Sometimes they are quiet, just quiet. They don't want to talk to anyone. I hope you have seen them. They're just quiet. You talk to them, they're completely quiet. Yeah. Sometimes they don't like things which they used to like in the past. For example, maybe they as a student, you know them, they study much, they don't go to study, they don't even attend classes. They don't if they used to play bow, you see them, they're not coming there. They no longer love those things. Yeah, basically those are some of the presentations.
Alright, what are the epidemiology for schizophrenia?
Okay, so epidemiology for schizophrenia is that the incidence itself, like for every 100,000, there are about 50 people who are diagnosed with schizophrenia every year. So for lifetime risk for someone to develop schizophrenia is about 1%. What do I mean? If we take 100 children who are born today, we raise them together. Out of these 100, there will be at least one person who have schizophrenia throughout the life of these people. 100 people. It's more common schizophrenia is more common in men, with about 1.4 to every one woman. So about 1.4. Of course, we cannot divide people in points, but in statistics it happens. And also the presentation is more early in men. Men present with schizophrenia around 18 to 20 years, while females they go up to 35 years. Yeah, so basically that's it.
What is the diagnostic criteria of schizophrenia?
Okay, basically a person is supposed to have at least two of the following. A person must have either hallucinations or delusions, disorganized speech, disorganized behavior, and the negative symptoms which I've said. And these symptoms must be there for at least 6 months for you to say this one has schizophrenia. And all these symptoms shouldn't be attributed to drug and substance abuse. Like if someone was smoking and was drinking, and you think the symptoms are due to drug and substances, then that's not schizophrenia. Schizophrenia shouldn't be secondary to drug and substance abuse. When someone is showing features of psychosis, and they have been abusing drugs and substances, then it becomes drug associated psychosis. But schizophrenia shouldn't be associated with drugs. Yeah, and it shouldn't be secondary to other medical conditions. Like maybe a person during their childhood, they had a, they had a, maybe they have been suffering from cerebral malaria. You know, some people who have been suffering from cerebral malaria, when they grow up, they may become not normal in their brain. Their brain is disturbed by malaria. So when they grow, they become kind of like mad people. Maybe I've seen someone to say, I think ali mwana ankadwala malungo kwambiri ndiye pano mtu akumakanga sumagwira. So yeah, sometimes so schizophrenia shouldn't be associated with any medical conditions. Yeah, so that's how we diagnose it. It's supposed to have at least two of the following: hallucinations, delusions, disorganized speech, disorganized behavior, or negative symptoms. These symptoms must be there for at least 6 months. These symptoms must not be attributed to either drug and substance abuse or any medical or psychiatric condition. That's how we diagnose schizophrenia. Sure.
Uh, how do you manage? How do you manage schizophrenia?
Okay, so management, we manage schizophrenia basically in psychiatry, we manage a person. We don't manage the disease. Okay? Yes. What do we say when we say we manage a person? When you want to manage a certain condition, you need to consider the person as a whole. Well, so what made up a person? They have their biological being. When I say biological being, we mean the condition which they have, schizophrenia. Then we manage their psychological. Psychological is now their thinking capacity, and social. Social is about their everyday life, their life outside them. So we combine these terms, biological, social, and psychological. We combine them to say biopsychosocial approach. That's how we manage schizophrenia. Biologically, we give patients antipsychotics. Okay, so we give patients antipsychotics. So antipsychotics are just medications which are given to deal with those chemicals which we call neurotransmitters, which are derived in the brain and which are known or which are suspected to be involved in the development of schizophrenia. So these antipsychotics, they are going to counteract those disturbances in the brain. That's biologically. Now, psychosocially, how do we manage them? Psychosocially, we manage them. We can manage them by doing what we call psychoeducation. When you say psychoeducation, it's teaching them about their illness. People are supposed to know what is happening to them. Whether they don't understand you, but sometimes they get some of the things which you are saying. But you need to educate them. You need to educate the patient themselves, and also need to educate the parents or the guardians. They need to know whatever is going on with their children, with their husband, with their wife, I don't know, with their parents. They need to know psychoeducation. So you tell them like the way I'm explaining now. What is it? How does it come? What are the risk factors? what are the management remedies available, and you need to tell them the prognosis of the illness. That's like medication. The other way is we use what we call cognitive behavior therapy. Cognitive behavior therapy basically is a matter of you teaching the patients how they can counteract negative thinking or negative thoughts which they have been having. If they think they are not worthy to live in the society, they should say I'm worthy. If they feel like they are not even part of the world, they should say I'm part of this. They should value themselves, because you and me, you know how these people who have been having psychiatric conditions, how they suffer in the community. They suffer stigma, isn't it? Do you know stigma? Yes, they suffer stigma. Kuti ndikufuseni mukachizeni nzana amene anagonekerapo ku mental hospital, it will be difficult. People tend to discriminate them. If they say something which doesn't make sense, sometimes people be like, I'm mental. You see, but they are okay. So that thing can make them to develop another schizophrenia, because they become sad. They think about that. They may be depressed. Sure, basically that's it. So you also consider other things, like they say the patient is an adult person. You need to teach them how they can sustain their everyday life financially. So you teach them how they can some of the business strategies available. You can teach them. You can send them to school so that they learn about technical issues. Yeah, at least the social skills training. They need to have something to do so that they can be busy. And sometimes you can send them to rehabilitation. So rehabilitation is whereby the patient is okay now, has been treated, but you know that I think we just need to be taught here and there with our friends in rehabilitation, so that they can become normal again. Sure, that's it.
What is the prognosis of schizophrenia?
So when you say prognosis what of schizophrenia, it's about 15% of people with schizophrenia. They normally have just one episode. At that time, they have developed schizophrenia. That will be the only time. They will never have another episode. About 15% of people. But majority, they go up to second episodes, third episodes, and they have multiple hospital admissions due to the condition. Sometimes they develop depression, like I explained to you. They may be depressed when they are discharged. People don't even love them. People don't want to interact with them. People think they are mad. Okay, so they develop secondary schizophrenia, secondary to another condition which was there. And that's sometimes they die by suicide. Let's say no one is loving you. Let's say in real life, you are a girl and no one is coming to propose to you. You'll be like, what's going on with me? You try to put mercy, you try to do whatever, you try to put makeup, you try to put lip gloss of different colors. Okay? But no one is coming. You'll be depressed there. So it's same as these people. They become depressed.
Mm.
Okay? And also normally they have around 15%. I mean, the lifespan for the patients with schizophrenia is about 15%. I mean, 15 years. So if you 100 people have schizophrenia now, about 15%. I mean, about these people, we count that their lifespan has been is about 15 years shorter. So let's say, what is the lifespan of people in Malawi? Average. It's about 65 years. Yes. By 65 years, we need to die. But people with schizophrenia, their lifetime is reduced by about 15 years. So it will be about, around what? 50, 50 years. So they die earlier. Why do they? Why do they? Why do they die earlier? They don't die earlier because of the disease itself, but they die earlier because of the complications of the disease. Because they have developed depression, sometimes they kill themselves by suicide. Okay?
Yeah.
Yeah. So basically,
Well,
that's the prognosis.
thanks for your time.
Thank you. You need to come next time for other session.